Hey, gentlemen.
Hey.
Hey, how you doing?
Dr. Rob Davidson. How you doing?
Hey, Rob. Good to meet you.
Hi there. I'm Joel.
Joel.
So I'm
Nice to meet you, Mr. Vice
an
President.
emergency doctor. I'm worried about the plans they talked about last week of maybe cutting Medicare and then the rollout today of cutting Medicaid. I work in one of the poorest counties in Michigan, and my patients depend on expanded Medicaid. So how is that going to affect my patients?
Yeah. I hadn't heard about cutting some Medicaid.
Cut Medicaid, yeah. The head of CMS announced the plan to let states file for waivers so they could get block grants. So that would essentially cut the amount of money going to the states. So it would cut federal Medicaid funding. Is that a good idea?
Actually, when I was governor of Indiana, we got a waiver from the Obama administration that actually allowed us to expand Medicaid coverage in the states.
Right, but now they're
But to
talking
do
about
it-
scaling back the Medicaid expansion that we got with the Affordable Care Act, and that 680,000 Michigan or 600,000 in Iowa. I mean, a lot of people got
But I'll
health
tell
care.
you, we expanded coverage in Indiana with
Right, but I'm
waivers.
just talking about the president and your administration right now, what they're doing.
Right.
Right now, they're
But
cutting
those
Medicaid.
are waivers for states that didn't take expansion.
No,
money,
it's for
right?
people who took expansion money too. I mean, your administration just announced this, they rolled it out today, and it's going to affect millions of people across the country cutting Medicaid. I mean, is that a good idea or is that a bad
I think
idea?
you're oversimplifying it. I really
Well, I think it comes down to that for the people I take care of all the time. I mean, people I see in the emergency department that can't get primary care doctors, once they got Medicaid, they could get primary care doctors. They stay out of the ER. They actually work more. They actually contributed to our community more. Now, if we tell those people, sorry, you don't get your health care, I mean, that's going to be a real negative in their lives.
Yeah. Well, if you check out what we did when I was governor of Indiana, the Healthy Indiana Plan, which was the first consumer-directed
Yeah.
waiver that was given
Yeah.
ever. We expanded coverage. We used consumer-directed health care. People were able to take more ownership of their own health care and expand it.
I mean, I think
Expanded.
if the Trump administration and you want to expand Medicaid, that'd be great. But the problem is
It's
they're
not a matter of
contracting
expanding, it's a matter
Medicaid.
of improving. I think Medicaid, is a lot of problems.
It's been a godsend to the patients I serve in one of the poorest counties in the state of Michigan. And I know people here who work in Des Moines, friends of mine who work in the ERs here in Des Moines will tell you Medicaid is a godsend.
Well,
It's their lifeline. People with diabetes who can't afford insulin.
I think
It's
our
a
vision
crisis.
is for state-based innovation and reform to be able to
Well,
improve.
Reform and innovation in the setting of
Opportunities.
cuts equals less people with health care.
Yeah. I
So,
respectfully disagree.
okay. Okay. Well, I encourage you to make sure that we don't cut those folks off of Medicaid because they need it. Okay?
Thanks for
Okay.
Thanks for your courage and care.
All right. All right. Thanks.
Really, truly. Thank you, man.
Thanks for talking.
Yeah, nice to meet you, man.
Thank you, sir.